Before we jump in, a quick heads up. The opinions and stories shared by my guest are theirs, not necessarily mine. I'm a beauty enthusiast who loves bringing you new voices and ideas, but all thoughts, advice, and information you hear on the Beauty Biz Show podcast belong solely to the guest. And remember, nothing on this show is meant to replace professional or legal guidance. Now, let's dive into the good stuff. Welcome to the Beauty Biz Show. I'm your host, Lori Crete, a career-loving esthetician and beauty entrepreneur on a mission to empower fellow estheticians. If you are a solo or small business owning esthetician and you enjoy this podcast and curious about how we can work together, visit beautybizclub.com for mentorship and essential business growth tools. If you're looking to boost your retail sales and elevate client care, check out my line of luxury spa wraps and headbands at spastar.net. Now, join me as I bring you inspirational messages from beauty industry experts and practical tips to help you achieve beauty biz success. Get ready for some serious beauty biz entertainment.
Good morning, everybody. My name is Lauren Natuno, and welcome back to the Beauty Biz Show. This is an extra exciting episode because not only is it my first solo cast without our amazing host, Lori Crete, but I also have invited an incredibly special guest to join me today. For those listeners who don't know who I am, my name is Lauren Natuno. I'm a small business owner and a career-loving esthetician. I'm a success strategist and a coach inside of the Beauty Biz Club, and I'm super happy to be hosting today's show. I am super excited about today's guest. I would like to introduce somebody who means a lot to me, and also somebody who has taught me so much during my career, the incredibly talented plastic surgeon, Dr. Emily Ridgway. Hello, Emily.
Hello, thank you for the wonderful introduction.
I'm so happy to have you on the show today. And I know so many people are going to be so interested in this topic. I feel like in 2025, plastic surgery has been trending almost. So I'm super excited to dive into some fun stuff today.
Absolutely. I'm delighted to be here.
Okay, well, why don't you just tell us a little bit of, who you are and how you got to where you are in your career.
Well, I am currently in Bozeman, Montana, running a private plastic surgery office with a medical spa attached. And I got here initially from med school in New York City, residency in New York City and then Boston, and then had my first job for 7 years at Dartmouth, which was a big academic practice, and then wanted to be closer to family out west, and so came to Bozeman, and there are no academic positions out here, so had to start an office, and quickly learned that so much of private practice in plastic surgery is aesthetic medicine, and the whole spectrum from facials to facelifts, and so have been doing all of that for the last 8 years.
It's so fun. And for everybody, all the listeners, I got the privilege for working. I worked for Emily early in my career. I'd only been a licensed esthetician for a year before you guys hired me at Ridgway. And it was like a very pivotal point in my career. And it's crazy, the amount that I learned from you in my time there. But I feel like it taught me so much, not only as an esthetician, but also just like as a person. So many people don't know the ins and outs of that kind of stuff. So I was really looking forward to having this discussion with you. And one thing I've always wanted to ask you that I felt like I never did when I worked there was, you obviously were going to open a plastic surgery office, but why the med spa? Why did you also want to incorporate, the med spa aspect? And do you think that the industry has been what you hoped it would be since you opened?
I think it's been way more than I hoped it would be. I think it's just such a growing, amazing field. And the reason why I think they're so complementary to have a med spa as part of a plastic surgery office is that if someone comes in and they have concerns about, for example, their nasolabial folds, you can say, okay, you could do a peel, you could do laser to try to tighten the skin, you could do filler, you could do a facelift, and you can talk to them about all the different options and you have them all available to you. And then pick based on their anatomy, based on their desires for downtime, based on their finances. You can pick what might be the best solution for them at that time. I think anybody who doesn't have all those things to offer might be, if you only have your surgery options, you might not offer something lesser. Or if you only have your injectables, you might not offer a facelift and might be filling somebody more than they need to be. So I love the idea of being able to educate people about all their options and then be able to offer whatever is best for them at that time.
Yeah, I feel like it's so nice that you have such a broad, like you have so many different options for every single person, even somebody who might want to end up getting surgery but maybe isn't quite ready for that. You have so much more to offer them. And I feel
I love it
like,
that we get to like build a relationship with somebody. So you're not just eventually going to do a surgery on them. You are getting their skin ready with skincare, making sure that part of it's covered. And if there are any, sort of dyschromia or other sort of texture abnormalities, you can take care of that with lasers. And then during all this time, you're building trust in a relationship. So somebody knows your values and your style, and theirs also, so that when it comes to doing something big, you've already had lots of touch points or encounters with the patient.
yeah,
And hopefully they can feel really confident in their treatments.
yeah. And then you also create like such long-lasting relationships with your patients. I feel like, um, you've had patients coming for different sorts of treatments, for the last 8 years since you guys opened. I feel like you've created this kind of place where it doesn't matter how big or how small their need or want might be, they're still able to come um, to your practice because you have everything there for them.
I love it that it's like at different stages of someone's life. So maybe they have breast cancer in the worst case scenario and have to have a treatment for that, but then they sort of have gotten to know you over several months, and then later when they say, oh, my eyelids, or oh my gosh, my face, something like I lost weight with chemotherapy and now I'm 5 years out, they know I'm safe and recovered. Now I really want to do something nice for myself. I want to do facials, or I want to do a laser treatment or a surgery, then they can do something fun also. That makes them feel better.
Yeah, and really boosts their confidence. I
Lauren,
was,
Lauren, you might not know, audience, was not only an esthetician at our office, but also a surgical assistant
yeah.
and did so many amazing things and was such an incredible asset to the office. So she has seen all the surgeries, and she, I think, also as an esthetician now knows like, okay, this patient has these concerns, these things that they're asking about are going to help, or these things are not going to help, where to steer them, and just as a superior asset for any patient or client.
Thank you. I feel like I think about it all the time because even now, not being at Ridgway, sad, but there's lots of times where I'll send clients who will even just during their facial mention something about their eyelids or mention something about their skin or something about something that I know I will not be able to help them with, but knowing and and being able to have spent so much time listening to you talk to patients, it's nice, feeling like I might not be able to do much in that area, but I know exactly where to send you. And it's really nice being able to have that option for them and being able to say, I got to literally watch this woman do what she does and she's the best. And then they come and see you and then they come back and you're like, you're right, she's the best. And I just think that that's so fun as an esthetician, being able to not only spot where, I might not be the one that can help them, but I know exactly where to send them for the help that
And
they want.
and that we can just complement each other. There are so many things that you can do that I can't do. And so we really can have that back and forth with patients.
Yeah. I feel like you mentioned eyelids, and what's fun is I feel like we just closed out 2025, and I feel like a lot of people were talking about a bleph surgery in 2025. I saw a lot of people getting it done. Do you feel like there was any surgeries or just services in the med spa that you saw really, boost up in 2025? And do you see any, things that you think will be really, really popular in 2026?
I think for the body, one thing, and then we'll talk about the face. I think for the body, something that has really been increasing over the last couple of years is implant removals and doing a lift at the same time. People are ready to have like ballerina or Pilates bodies and breasts included. And so that like perky, smaller breast people are really interested in. And
Mhm.
then with that, doing sometimes injections of their own fat. So if there's one little area like a muffin top that bothers you, if you're going to have that little bit of liposuction done, say you're at your ideal weight and you're fit and you're healthy, but this one stubborn spot, instead of just throwing it away, do like a little boost where you do the liposuction of that area and inject it in that upper middle part of the breast just to improve that shape. That's the visible part for everyone. I think that over the last couple of years has increased a lot. And
Yeah.
then for the face, the eyelids, but something that I feel like is getting even more attention is paying attention to the brow too. So people come in
Mm,
and they say, "Oh, I want my eyelids done. My eyes are so heavy." And you see them and they're lifting their brows the whole time to try and make it better. And so you try to examine them, get their brows totally relaxed, and then see what the eyelid skin looks like and where the brow is. Because if somebody has a lot of lines in their forehead, they've probably been using their brow elevation to try to compensate for that extra eyelid skin. So you're trying to see like, is that skin only on the eyelid extra, or is the brow hanging low too? And then a little improvement by raising the brow, which can be even like an office procedure. It can be a smaller thing than the huge old fashioned like over the head big incision. Now it's like a little incision, either right behind the hairline or at the hairline. And especially if somebody has extra eyelid skin that's beyond the corner of their eye over here, like a blepharoplasty isn't going to help that. Usually that means, okay, we're talking about a brow lift and then a smaller blepharoplasty.
yeah. I always forget about a brow lift, and I feel like a lot of people do. And you're right, like constantly lifting the brow is, I can see where you're coming from and how you'd say, when you're examining them, it's like what's causing them to want to get
The
their eyelids done.
heaviness.
Yeah,
Yeah.
yeah.
Usually the combination is so nice too, because it's subtle. You're not doing either of them in an extreme way. You're doing some at both of the areas. So it's sort
Hmm.
of like, did you color your hair? What's going on? Did you get a tan? Like they look better, but it's nothing as super extreme or obvious. It's not that kind of, we think when you those old brow lifts, you would raise the medial or the middle part of the eyebrow too. And so it would give you that surprise type of look. And now you're really only raising the lateral third of the eyebrow. And so it's just improving that arch shape. And it's just such a nice result for most people.
Do you feel like that's something that can sometimes people are overcompensating for that with Botox? Do you feel like when you're examining somebody, if they are treated heavily in the forehead and it's keeping the brow down, is that something that you would want to wait then to examine them maybe when their Botox has softened?
Absolutely. Yeah. For deciding anything about a brow, you'd want to see the forehead without Botox. And
Mm-hmm.
heavy Botox in the forehead can be really great if somebody wants to have a super smooth, glassy forehead. It's great, but it's the only muscle that raises the eyebrows. So if you paralyze that completely, their eyebrows are going to be heavy. And even people who don't necessarily need a brow lift can look like they do with heavy Botox. So I think over like age 30, 35, when you're doing Botox in the forehead, being really light with it and sticking at like the upper part of the forehead so they still have the ability to raise those eyebrows is
Yeah,
important.
that it's so interesting. What do you feel like, because I feel like we really are living in a time where even solo estheticians like me that aren't in a med spa still have so much overlap with clients getting these injectables done, getting fillers, Botox. What do you feel like, if any, are there any common misconceptions and that you encounter when it comes to plastic surgery or med spa services? And then how can like a solo esthetician like me help educate our clients about these topics? And I guess, do you feel that it's important for estheticians, even though we don't learn about it in our curriculum, to educate themselves on these things that all of our clients are getting?
Absolutely. I think a few questions in there. So first one
Hmm.
about misconceptions. I would say the biggest misconception I hear about is they want to have surgery, but they don't want to have a scar. Like that just can't happen. Like it's going to be
Yeah.
there. It might be like very hidden, depending on the area of the body, but there's always going to be a scar if there's any kind of cutting. And so just to like recognize that, and then you talk about exactly where those scars will be on the belly and the breast. Those are hidden under bikinis or underwears and bras, things like that, but they're still really visible if you don't have that stuff on. And then face and eyelids, neck lifts, brow lifts, you can hide them really well, but they are still there. So just I think that part of it, and then downtime. People are always like ready to go, ready to get back to all their normal activities quickly. And I said, this is something where you're going to have a couple weeks where you're going to look puffy, kind of swollen, a little off. And so just to not have any like dining plans with people you don't want to know that this
Yeah.
happened for the first 2 weeks at least.
Yeah.
And I think for esthetician involvement in the whole industry is hugely important. And if you have the time and curiosity to get educated on it, I think you'll be able to help your patients more and prepare them and say, okay, after surgery, I'm going to connect with your surgeon because we should be doing lymphatic massage, 3 times a week that first week, or whatever it is, if they've had a treatment, some kind of laser where you can help with the healing process. I think that would be, and how to prep their skin ahead of time for a surgery. I think all those things could be major assets to a patient.
Yeah, I agree. And also could be such a huge, um, it could be something that sets you apart as an esthetician, I think. Um, Being able to offer that kind of knowledge to your client, and especially if they feel comfortable enough with you to discuss those types of treatments with you that they might be thinking of having, it can be like a really beautiful, cohesive relationship, like we were discussing earlier.
Absolutely. I think your patients would love to be able to talk to somebody that they know and feel comfortable with about the options before they take that step and go see a surgeon to say, like, what is it really like? Like, where are the incisions going to be usually? And how long do you think I'm going to look bruised and swollen? And do you think it would help with these areas? This is my main
Yeah.
concern. Just knowing all those things would be really interesting. And for any like estheticians in other communities to get to know a plastic surgeon so that if you have patients, you can have a relationship and refer back and forth.
Mhm.
Because plastic surgeons also refer, like want all of our patients to see Lauren for their care too, between surgeries.
Yeah. And you know what's funny is, and I haven't even told Dr. Ridgway this, but it's so funny because it happened a couple weeks ago. We have a shared patient, and she um, had just had a breast augmentation done at Emily's practice, and she came in to see me for a facial the next day.
Oh
And
my
I
gosh.
remember telling her she walked in with her husband, helping her up the stairs, and I was like, "What the heck are you doing here?" And she was like, "Well, I just knew you'd know." And so, did all the things, made sure she was comfortable, and it was just so funny to me that not even 24 hours later, she was not missing her facial, but she had just had a breast augmentation.
Well, you have some downtime, so it's a good time. I always tell people Ted
Exactly.
Lasso TV and puzzles and facials. I should have added that to the mix.
Yes. Just a quick message, and then we will be diving right back into the episode. For all of my estheticians just getting started in this incredible industry or going solo for the very first time, building your unique brand, building your business should be the fun part. I've got a little secret for you. Gloss Genius. This is a company that truly believes that businesses deserve tools that elevate their unique brands and build direct connections with clients. Don't let your online scheduling software be the last thing you think about, because it is so much more than just that. Think of it as your best friend in the business. That is why I love Gloss Genius. Gloss Genius makes everything so easy. It is an all-in-one platform for scheduling, payments, marketing, and so much more. It's built to make your brand feel elevated and cohesive from the very beginning. From your booking site to your workflow, it takes away all the headaches so that you can just dive into your passion. When you're just starting out, you want everything to flow effortlessly, and Gloss Genius helps you do just that. So if you're just starting out and you are looking for a platform that helps you build a brand that you're proud of, bring in clients, and take all the busy work off your plate, Gloss Genius is waiting for you. So you in town, especially in our small town and in our state, really, this was a big question that the audience was asking. There's a lot of male plastic surgeons in the industry. Do you feel like as a female plastic surgeon, you have more women might feel more comfortable coming to you? I know that as your MA, it seemed like that sometimes, that you sometimes have a wait list over a year long, and people are willing to wait. And a lot of people were wondering, you know, even if there are other people in the valley or in the state, do you think that people really just feel comfortable with you because you're a woman?
It's such a delicate area because you want to make sure we're not being like reverse sexism or anything like that
Totally.
against
Yeah.
the men, because I think the male plastic surgeons could be equally or more talented, for
Incredible.
sure, surgically. But I do think there's some just inherent difference in that, I have breasts, I have had babies, so my belly skin
Oh,
is different. So those feelings. And I always find it amazing when you're at a conference and there are like six men up presenting about like a breast shape, what it should look like, and how to do the surgery. You're like, wait, you guys don't even have one of these. Like, how do you know how it should feel? What are you talking about?
yeah,
We call them manels instead of panels because you're like, why are all the men talking about the breast ideal shape? And
that's so
so
funny.
I think
Like,
there's also like some patients that are looking for what is the ideal shape appearance from a man's point of view. And so for some patients, that will be the male surgeon to go to and get that
yeah,
answer.
yeah.
I feel like I am much more about like, what do you want? Even if your husband's in the consult, we want to know exactly what you want and how to
Mhm.
prioritize that. And even maybe it takes a private conversation sometimes just to make sure you're on the right page with the patient and achieving their goals. Because sometimes they can be a little different from a husband's or partner's. So I think
Totally.
I feel lucky in just being able to hopefully be a good listener and supportive of achieving someone's goals. And that might be what makes me connect with them more than even being a woman also.
Yeah. And I think from a patient's point of view, they might feel more comfortable, but really, you're right. There are so many incredible plastic surgeons who are men. And even, seeing you work on certain cases where were sharing with, other surgeons for, some, I remember there was many times where are you on like a panel of some sort, and sometimes you guys discuss cases and different techniques or approaches, stuff like that. And it's funny, like it is just a really incredible specialty, and female or male, there's so many talented surgeons when it comes to plastic surgery.
Yeah, it sort of leads to that conversation about facelifts. Like, what is the best facelift technique right now? And we've been talking about that a lot in the plastic surgery community with the questions of the deep plane facelift. And it seems like the consensus is the best operation is the one your surgeon has done the most and feels the most comfortable with. The positives of the deep plane facelift ideally is a shorter period of looking swollen, less skin elevation, so maybe a little shorter surgery. But you're also like zapping right next to all the little nerves. So maybe, or yes, a higher risk of there being some kind of nerve injury. I always was taught like if you even see a nerve, it's going to be delayed in how it's working after surgery. So for me, doing the deep plane facelift is a little like, oh my gosh, like your heart is racing. It's a new thing. And so I've always done the SMAS plication surgeries and think we get great results doing that. But if somebody is coming out of training now and they've only done deep plane, even if it's a little scarier operation in general, like that's what they should do. Whatever they're going to be most comfortable, they're going to get the best results that way. I think you can get great results with any of the operations. One of the most famous plastic surgeons in New York City, Dan Baker, he does a traditional like smazectomy, which we think is like older style type of surgery, but he has incredible results.
Mm-hmm.
So it's just whoever's hands you're in,
Yeah.
and getting different opinions if you can, if you have the time to see different surgeons and to make a connection where you feel like you trust that person, you like their style, you get, sort of set your expectations, and that they say, oh yeah, I can achieve that. And that would be, I think, the person or the type of facelift to go with.
Do you feel like you have been noticing younger women interested in, like, we hear the term mini facelift or facelifts in general. I feel like with new techniques coming out, do you feel like it's impacting the age of your patients, like younger patients wanting these surgeries?
I feel like there's always been a group of younger patients, a small percentage, but like even in their 30s, starting to
Mm-hmm.
have facelifts. I remember in
Wow.
residency, there was a woman who was having her third facelift and she was 39. And I was like, oh my goodness, what is going on here? And then being in New York City, there was another woman. She was in her late 40s and she was so beautiful already and having a facelift because her sister had had one and her sister offered to pay for it for her. So she was like, yeah, I'm going to do that.
Heck yeah.
A- And so there is that small group of people, I think, that can't tolerate aging. And once you've done it, say you have your first facelift at 35, you're like, imagine your 35-year-old face. If that's what you want to keep, or something even like more useful than that. When you're 12 years later and you're 47, you're like, oh, I need another one. I can't see this going on. So you're going to have a bunch of facelifts over the course of your life. Um, but that is a small percentage. I think something that is new that is going to be seen a lot around this next year is and last year even, is the coring devices. So it's like
Mm.
removing little teeny channels of skin all over. So instead of removing it like just at the side where you do the facelift part of things and excise it, It's like little dots of removing skin everywhere where you want to. So you can focus it on the cheeks if you're trying to improve the nasolabial folds or the marionette lines along the jowls. We do it in the eyelids, in the forehead. There are two main devices, the Ellacor and then the Ultra Clear. The Ellacor, I think, makes a little bit bigger channels than the Ultra Clear, but both of them can be done on people awake or with a little bit of sedation, and I think are really taking off right now.
Wow, that is just, I mean, this industry in general amazes me because even with new implants, like, new implants, just new technology, new techniques, like it's never ending. Like I remember, when you guys were bringing on Renuvion and, it's just like never ending. How do you choose? What do you, as the business owner and surgeon, do you like to, and I think I know the answer to this question just from working with you, but do you like to hop on the new things right away, or do you like to see how they go, let them ride out a little on their own before introducing them to your patients?
I think anything invasive, I want to watch it and make sure there's some real evidence that it's going to work, because there are so many things that are being sort of promoted and sold every year. And it's going to cost us a lot of money, but also it's going to cost patients a lot of money to have the treatments done. And so I want to make sure anything that we're offering at the office somebody's going to leave with results. And so I usually wait a while on almost everything. I think there are some things that I get a little excited about, like South Korean facials and things like that, that I'm like, oh, let's push this. This is so exciting and fun. But it's a low price point for people and low expectations, but that we get to try these things, because I think
Yeah,
people maybe all over the States, but even here, want to know what a salmon sperm facial is and try it
I
and
was
see,
just
like,
about to ask
oh
you.
my God, is this amazing? Or is this like, might as well be like microneedling, and just for everybody to be able to try that here.
I know. So are you. How do you feel about the salmon sperm facial?
I have not had it done, but the patients that I have seen who've had it done really like it and have come
I
back multiple times. So I'm like, okay, I guess it's a
right.
positive. And it's one of those things where I feel like we can, with something where it's low risk, where you get to
Mhm.
experience it and try it. And each person, like, there are so many treatments and peels and facials that can be done. And if sort of like food or medications or anything like that, where something works for someone and feels great and they love it, great, we're going to support it
Yeah.
as long as it's not
That,
dangerous.
yes, exactly. Low risk. Speaking of just like that salmon sperm situation, I feel like with the rise of social media in the beauty influencers and all of that talk that goes on online, and we're all constantly being consumed with the new thing, or so and so got this procedure and so got this sized implants. Do you feel like it's impacted patient expectations and decisions regarding their lasers, their Botox, their fillers, their surgeries? Do you feel like it plays a part?
I like the transparency of it, like people admitting, or, oh, I did have a facelift, or, oh,
Yeah.
I did go have a breast enhancement type thing. I love that for patients, because they can say, okay, yeah, this person just wasn't born or isn't 62 and looking like this
Yeah.
naturally. Like they are working a lot at this. And you try to, I think the social media part, we're comparing ourselves to say, okay, yeah, I'm Anne Hathaway's age. Why do not I not look like her?
I
And then you're like, it's their job to look beautiful, and they are paid to exercise and paid to look beautiful all the time. That it's just that we can be more transparent about, okay, yes, she is doing these treatments, say she has a facial every week and microneedling every month and
know.
Sculptra, this, and then facelift, and just that we don't compare ourselves to them unrealistically.
Yeah.
So I think the transparency has been good.
That is something that it is kind of like it is kind of like a breath of fresh air. Like just being able to see that, these plastic surgery has been around for so long. And a lot of people for a long time, like we're trying to do it so under wraps, and now it's so normalized to get these types of enhancements done. And it is a really nice thing to see somebody be like, yeah, I mean, I have 65 units of Botox in my face, or, you
Yeah.
know, certain, you know,
Yeah.
this here, that there. So it is nice.
I
What's
think
funny
there's
is,
so, oh, sorry, go
no,
ahead.
go ahead. No, we'll say whatever.
It's funny, like traditional plastic surgery offices, you always have to have like a exit where somebody who can have a treatment and then get out to their car without being seen. And
Yeah.
now we always wonder like, oh, we don't want to have the office in a public area because people will see you going in and out. And now the scales are sort of turning where it's like, is it a badge of honor that that you're
Yeah.
treating yourself and getting Botox and you're not as embarrassed anymore? Or people, I feel like friends are talking about it. When I'll go to dinner with people, they'll say, oh, what should I do? Or how
Mm.
would you do this? Am I too young? And
Yeah.
people want to talk about it and have questions. And I always try to say, this is like my one gift I can do. I can like sew up your children's faces if they hit a ski pole or something, and I can
Yeah.
tell you about skincare or skin treatments and just to normalize it and talk about it.
Yeah, it's so fun because I remember when I worked there, because you know, there's always going to be those patients that want to come around and go through the back door. I feel
Yes.
like, you know, especially, I feel like, you know, you would have two facelift patients and one, and you know, they look like a mummy, their first appointment, you know, with all their bandages on. But I feel like there's always going to be that one that walks through the main lobby loud and proud, like, heck yeah, I just got this facelift. And then there's always going to be somebody on the other hand who's like wants to come around back. So it's
Or come
fun,
in
but
on Saturday when nobody else is there and stuff.
after
And
hours.
yeah, it's to each their own. I don't know what I would do or what
I
I will
know.
do.
Exactly. I feel like, okay, this is a fun question because I feel like as somebody who's gotten to see firsthand how you approach cases and people and patients, can tell me just a little bit briefly how important you think in today's world with the social media, with everything, how important mental health is in the decision-making process for patients considering any plastic surgery or Botox or fillers or even laser treatments, anything within the med spa plastic surgery realm.
Oh, that's so difficult because I think like there's part of me that says you can get into some trouble with legal situations if you're doing invasive treatments on somebody who has a diagnosis of depression or anxiety. There have been a lot of cases about, and this is an extreme situation, of people having depression and anxiety and then transitioning to from a female to a male, for example. And they have had lawsuits for somebody who said they were depressed and had the surgery, because then they could say I wasn't in my right state of mind. And if you knew that ahead of time and did a treatment on them, you could potentially get into some trouble. But then you also have the other side of it with like most of those patients who are wanting to transition and have been living in a body that's not comfortable for them for years could be depressed because of it and anxious for because of it. So it's so complicated with like
Yeah.
those are like invasive things. I think mental health for treatments like facials, lasers, injectables. I think like some, like not a specific diagnosis where you are clinically depressed, but just feeling kind of in the dumps about yourself. Some of those things can like be a boost for people's, mood and how they're feeling about life and themselves. And some of that is how it looks, but some of it is also just like, and probably the majority of it, just saying like, I took the time to make an appointment, to spend money, to do something just for myself. And I was empowered by that experience. And that probably on its own, never mind the like effects of what it looks like, but also probably can make people feel better. Because I do feel like most treatments that you or I do, people feel much happier after doing
Yeah.
it. And so probably it's about having that choice and the power to do something more than the actual procedure itself.
Yeah. And even I feel like for like me and just being an esthetician, even if it's something as simple as a 60-minute facial, I feel like most of the time our patients and our clients are leaving in a better mood than when they
Mm-hmm.
got to the clinic. And it takes it all the way back to just how you're saying it's so important to build these really like trusting relationships with our clients and with our patients, because I feel like you, as a provider, and I got to see it firsthand, you always are taking that into account when you're doing consults. I feel like you're always, paying close attention, which I feel like is a really special quality of yours. And I just think that it does make a big difference for patients and clients to feel like their provider is really paying close attention to them, really listening to them and hearing out, things. So I feel like it is a big part of our job in the beauty industry to just like hold space for our clients and our patients to feel comfortable enough to tell us whether or not, how they're feeling about certain things.
Mm-hmm. That almost bridges into a little bit of the body dysmorphia thing,
Mhm.
and diagnosis, and just to be like aware whenever you're talking to a patient about if they come in with a concern about something like their nose shape and you don't really see anything, to really explore it carefully. And there is like some DSM criteria and a questionnaire you can ask, but you can also just with sort of in conversation having those questions about how many times are you thinking about this a day, is it interfering with your normal activities, get a feeling for, okay, this person's concerns about this are out of proportion to the actual deformity or non-deformity, and maybe this person at this point isn't like a great surgical candidate. And so that would be a very extreme of what we're talking about, but just to always sort of, that's always in the back of a surgeon's head too.
Yeah, yeah. And I feel like it's very, it's something that you just always have to be aware of. And I feel like most people are doing a good job managing that with patients.
Absolutely. I feel like it's gotten so much press over the last couple decades where we really are thinking about that whenever you talk to a patient, or just also like whether it's their body dysmorphia or just their expectations of a surgery where you say, ooh, yeah, this surgery isn't going to do that for you. This is not going to meet your goals. This is not a good fit for you right now.
Right. Okay, well, I was also thinking of asking you because I feel like you are like the perfect example to me. When I feel like you are the perfect example of somebody that looks like, or somebody that appreciates invasive approaches to, plastic surgery and med spa. But also, I feel like you also appreciate a lot of the non-invasive approaches. And I feel like a lot of people, my clients, I've been seeing a lot of are interested in, PRP, microneedling. Like they're wanting to do these more non-invasive treatments. And I feel like we're also seeing kind of a rise in that, like especially with the PRP stuff. Do you feel like, I
Mhm.
remember when it kind of, when we saw it go from PRP and then it went to like the PRP gel, and now there's another one that I think that you guys are, that you're offering. And I feel like when it comes to that, I've been seeing great results. How do you feel about all of that? Because I feel like people are doing it.
Absolutely.
And is it, I feel like it also maybe enhances their filler and Botox stuff too. I feel like I've been seeing just a lot of people doing it and it looks so good.
It's the PDGF, and it's
Mhm.
like a platelet-derived growth factor. It has, I think, 200,000. I don't know, make sure I'm right on that one. More platelet growth factors than in PRP, and you don't have to have a blood draw. So people are loving that. And that with microneedling, I always used to say we should do like Botox every 3 months and then do Vivace like every 6 months. I thought that was amazing. Vivace being that radio frequency heated microneedling. And now I'm back to if you're less than 30, microneedling for just freshness, texture, any acne scars. Love that glowing skin. But over like 40 for sure, adding the PDGF with regular microneedling, I think it makes such an enormous difference. I tried it when we first got it just along my sides of my mouth, and I was like, that was an incredible, like really quick result. And they're like, no, 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 it's going to take 12 weeks to have the full effect. I was like, well, it's been like a week and I already think it's amazing. So
Yeah.
uh, I think that is a great new treatment for anyone to do everywhere. I think that always the trouble is the lines around the eyes, because you can't do filler for that. And you
Mhm.
don't totally want to Botox the eyes so they can't be making a lot of expressions, or same thing around the mouth. You could Botox it, but then you can't use a straw, you can't whistle, you're going to look weird. Um, so like, how do you trade off of those little lines? And I think the PDGF is great for that, those areas, along with the laser, like the CO2 or ultra clear lasers, I think for those areas are also just incredible.
Lasers are such a hot topic right now too. I feel like you guys just got a new ablative laser, correct?
Yep, the ultra clear.
Mm-hmm. And how's it been going?
I think everybody is super excited about it and very happy with it. It has the option for being completely ablative. It has coagulation options, and it has the coring of it too. So it is, maybe in 6 months I'll have a more detailed
Yeah,
report, but
yeah.
we've been so happy with it. And just speaking to other physicians across the country, they're using it all over the body. There's one woman in our surgeon in Denver, Diane Duncan, who's very well known, and she's doing a breast boost with it, where she's using that coring in the
Oh,
top or boost half of the breast for a little lift. I'm like,
wow.
amazing. So everybody's pushing all of these new technologies in different ways. The Renuvion, there's a new little handpiece for it that is much
Mhm.
narrower, and so you can use it in the brow to do a little brow lift with it. People are using it for little like face tightening also, and breast lifts also. So everybody's exploring things, and as the data comes back and we see long term, are these things good, we'll keep adding to our practice too.
Yeah. And for the audience listeners, Renuvion is a skin tightening device, correct?
Yep.
Okay.
It's or helium based, and then it's a little needle or wand that goes under the skin, usually used after liposuction, but can be done on its own also, and heats all the fibers that connect the skin to the fascia below it to tighten the skin. So great for loose skin after liposuction or after weight loss, um, but is not the same as skin excision for sure.
Yeah, yeah. Gosh, what a fun industry. What is your favorite part of being in the being in your beauty biz? What's your favorite part of it all?
I think the consults and getting to know someone and really exploring like what are their concerns. And yes, they're here about one thing, but do they have questions about other things? I always try to tell people at the end of a visit, like even if they're there because their son got a hockey stick into his cheek, say, you're here, you have my attention. Is there anything you have questions on? What can I do to
Yeah,
educate and help? And so I think those visits, really getting to know people, is my favorite part. And then second favorite or equal favorite is post-op visits. I just want to have 12, 20 post-op visits in a day on my schedule.
I know.
So I love seeing okay, you're at 1 week, you're at 6 weeks. What's it look like? How's the scar doing? We used a new suture technique. What do we think? Is it looking better than our other style of sutures? And just seeing people be really happy, I think is great. I love
Yeah,
that.
that is a really fun part, the post-ops, especially getting into like 6 weeks, 6 months, 1 year. It's fun.
What-
Well, I'm gonna close out the show by asking you one last question.
Okay.
What, if any,
Oh
advice
gosh.
would you have for women who are in the beauty industry, working in the beauty industry, or maybe somebody who's in school right now to become an esthetician or a nurse or an NP wanting to be in this industry specifically?
I would say there are so many opportunities out there, and you are going to be a total success if you are just a kind and a good listener to your patients. Like, there are so many people doing all these treatments, and you can outshine them all just by being like a nice person who pays attention to your patient's wishes.
I agree.
Is that
Oh,
enough?
well,
Is that a good
yes,
answer?
yes, that was a great answer. I am so happy that we got to have you on the show today, and I can't wait to listen to this back already. And thank you so much.
Oh my gosh, Lauren, you're the best. And our community is so lucky to have you and to have you
You
share your
too.
knowledge with the rest of the world. Amazing. Everyone come
Uh,
watch Lauren in action sometime. She is just a gift to this earth.
well, thank you everybody for tuning in, and we will catch you on the next episode of the Beauty Biz Show.
Thanks for tuning in to the Beauty Biz Show. I hope the episode has left you feeling inspired to build the beauty biz of your dreams. As always, we appreciate your kind reviews as it helps us attract amazing guests to be interviewed. Also, be sure to give me a follow on Instagram at Lori_BeautyBiz and SpaStar_Lux. If you'd like to know more about how we can work together, visit beautybizclub.com, where we are busy helping estheticians create outrageously abundant careers.